MSF has been working in Cambodia since 1989. Here, HIV prevalence is an estimated 1.9%. We started providing antiretroviral treatment in 2000. The UN estimated 7,300 children were living with HIV/AIDS in Cambodia in 2003. However, such statistics are hard to establish. There are practical issues that make diagnosing and indeed treating children infected with HIV much more complex and expensive than adults. MSF experience has shown that children respond very well to antiretrovirals. It is crucial that the disease is diagnosed early, particularly in the case of young children, because of the high risk of dying. Once diagnosed, HIV care can be started as quickly as possible. More than 90% of children with HIV contract the virus during pregnancy, birth, or breastfeeding. However, this mother-to-child transmission is largely preventable by giving antiretroviral treatment to HIV-positive women during the pregnancy and to the infant within a few hours of birth. MSF is working to decrease the incidence of mother-to-child transmission. In adults, HIV infection is commonly diagnosed through an antibody test, which provides a result in 20 minutes. However, these rapid tests are ineffective in young children because all babies born to women with HIV carry the mother's antibodies. These can remain in the child's blood for as long as 18 months. The most accurate way to diagnose HIV in infants is to determine the presence of HIV particles in the bloodstream. However, this method is complicated and expensive. The dry blood spot method is a more practical diagnostic tool which involves the analysis of a sample of the child's dry blood on a filter paper in a central laboratory, but this may take up to a few weeks to produce a result. We're using this method in many of our programs until more adapted methods are developed for resource-poor settings. It is not just with diagnosis that MSF faces challenges in the management of children with HIV/AIDS. There are many limitations with treatment which are amplified because the patient is a child. Treating a child today can be up to 4 times more expensive than treating an adult. MSF has been looking for inexpensive, child-friendly treatments that are not dependent on reliable refrigeration or the caregiver apportioning adult pills or capsules accurately, thus carrying the risk of over- or underdosing. With the need for pediatric antiretroviral treatment declining in the industrialized world, pharmaceutical companies do not have the commercial incentive to produce pediatric drugs. Fixed dose combinations, which combine different drugs into a single patient-friendly pill, are commonly used for adults. The World Health Organization has yet to approve the use of pediatric fixed-dose combination drugs generically manufactured in India. Whilst waiting for this pre-qualification, MSF has assessed and approved the use of these pediatric fixed-dose combinations for our projects. In addition, often children with HIV have been orphaned by the disease. Finding an appropriate caregiver to take responsibility for the care of the child, including adherence to the drug regimen, becomes problematic. As part of the child-appropriate approach to managing HIV, MSF is ensuring that mothers and their children are treated together. We're also working with professional and lay counselors to organize child-specific support groups to improve adherence to the drug regimen. To support this, MSF has created tools such as storybooks, health diaries, treatment calendars to improve children's understanding of the disease and its treatment.